Hi friends, how are you? Welcome to my YouTube channel D&D Pathshala. In this video, we will see regarding the clinical features of the copper poisoning and the diagnostic criteria and in the treatment. In the previous video, we have seen the physical appearance and the uses and exposure chances and the pathogenicity. So let's learn regarding the clinical features and the treatment and the diagnostic criteria in this video. Actually, the copper poisoning will be occurring in two types of stages. One is acute type and second one is chronic type. Now in the acute type of copper metal poisoning, the symptoms will be like abdominal pain, bluish or greenish type of coloration of the vomiting and diarrhea, oliguria and other kind of adverse effects like renal failure, seizures, delirium means the confusion, acidosis, methemoglobinemia or it can be also pronounced as methemoglobinemia, pancreatitis. Such type of conditions will get developed in the acute type. And coming to the ingestion type of conditions, if the copper salts are ingested, that is if they are taken on the second day or on the third day, hepatomegaly condition will be developed and the increased liver tenderness, and in the biochemical test, that is the transaminase levels may also increase. And coming to here, the ARF can also develop in 20 to 40% of the patients with acute copper sulfate intoxication. And it is also believed that mainly it is due to the intravascular hemolysis. And other type of symptoms like anuria, oliguria, these may also develop within the ingestion of the copper poisoning like 24 to 48 hours. And along with the ingestion, the burn levels may also get increased and inhalation of the copper dust or copper fumes may lead to the cough, sore throat and conjunctivitis to the eyes can also occur. And because of the copper oxide, it is mostly responsible agent for getting the metal fume fever. And if the eyes are exposed more, it may cause the corneal ulceration, palpebral edema, and by the copper alloys type of foreign bodies, a condition like calcosis lentil condition may develop. So because of this calcosis lentils condition, it will lead to the uveitis, abscess formation and also serious injury, and in very chronic stages even the loss of the eye may also occur. And if we observe with a slit lamp microscope, as we can't see such type of conditions even with highly advanced electron microscopes also. So if we observe under a slit lamp microscope, we can actually observe the greenish type of brown discoloration of the anterior capsule, that which is visibly produced by the copper as it is dissolved in the lens, iris and the cornea of the eye. So these are some of the acute features. Now coming to the chronic poisoning, because of the chronic contact of this copper chemicals, like if in this mostly in the swimming pool type of water, the green hair discoloration will be caused, and also because of the chronic inhalation of the copper sulfate sprays, vineyard sprayer's lung disease may occur. So because of this vineyard sprayer's lung disease, it is mostly characterized by histiocytic granulomatous lung, and liver damage can also be seen, and skin exposure may also cause severe irritation, erythema, eczema and dermatitis. So these are through the skin exposures like irritation, erythema. And in the lung, dyspnea, wheezing, metal fume fever, these are mostly caused if they are exposed to the fine type of copper dust. And this copper poisoning will be also causing a such type of other conditions, means this copper poisoning can also occur like if the copper containers are leached, means if the greenish type of coloration is occurred, if we store any kind of water, it may be normal water or carbonated water, and the juices like citrus juices, fruit juices and other type of acidic beverages. So if they are stored even by such type of conditions, the copper poisoning will get caused. And another hallmark of the chronic type of copper toxicity is Wilson's disease. Now what is this Wilson's disease? We will see in this point. In this Wilson's disease, a autosomal type of recessive genetic disorder will be seen. This is occurred by the deficiency of the ceruloplasmin, that is the special binding protein I have said in the copper metal poisoning mechanism in the blood. And in this Wilson's disease, we can also see a Kaiser-Fleischer ring, that is we can see on the peripheral part of the cornea. So it is one of the particular type of the feature that which is caused by the deposition or the deposits of the copper in the parenchymal tissue of the eye. And in this Wilson's disease, this Kaiser-Fleischer ring is mostly observed as like in the form of sunflower-like discoloration will be observed on most of the anterior layers of the lens. So this is mostly reported by the patients who have undergone the chronic poisoning of copper. And some of these are the other pictures, that is the enlarged type of liver in the copper poisoning. Uveitis. Uveitis means inflammation in the middle layer of the eye, that which is called as uvea. And conjunctivitis, abdominal pain and liver tenderness and sore throat, and because of this the swollen type of tonsils and throat redness may occur. Jaundice, pancreatitis, that is inflamed pancreas, and gallstones may also occur. And this is the Kaiser-Fleischer ring. Here we can observe the sunflower type of shape here. So this is the result of the chronic copper poisoning if it is exposed to the eye region. And these are some of the vessels that which are stored with the copper. Means these are the copper vessels. So these are stored with either any kind of water or with any other kind of item. Because of their over storage, it is turned into such type of greenish discoloration. So even if we use these type of vessels, the copper poisoning may occur. And these are some of the pipes with the greenish type of discoloration. These are the copper type of deposits. Now coming to the diagnostic criteria. So the diagnosis of the copper metal poisoning can be actually known by if we check the serum ceruloplasmin level. If this cerulo type of plasmin level in the serum, if it is 35 mg% less or more. So if it is less than 35 or equal to 35 after 24 hours, it is a serious type of toxic condition. Means actually normal blood copper level in normal ranges, if we observe in men, it should be 1.09 milligrams per liter. In non-pregnant women, it should be 1.20 mg per L. And when coming to the pregnant women, 2.39 milligrams per L. But if it is elevated beyond 1.5 milligram per 100 ml, then it will be leading to the serious type of toxicity. And when coming to the urine examination, the normal excretion should be less than 0.6 micromole per day. And the LFTs are also conducted like AST, lactate dehydrogenase, arginase enzyme, and sorbitol dehydrogenase. So these are some of the LFTs. And if we should calculate the hair copper level, it is actually very undependable type of factor for the copper toxicity, as there will be so many type of tests like serum copper, serum ceruloplasmin, and many other type of tests, because actually the copper can hide deep in the brain and the liver. So it is not a such type of dependable type of factor for ruling out the copper toxicity. So the above tests are preferable, but the hair copper level means it is some kind of undependable factor. And other types of radiographic tests that which we should carry are like X-rays, metallic type of copper, radio opaque test. So these are some of the tests. And in the most rare procedures, liver biopsy is also a good indicative procedure. But it is painful and it is a kind of non-invasive technique or procedure. So mostly it is not recommended. In rare case, the liver biopsy is indicated or preferred. Now coming to the treatment. Actually, coming to any kind of poisoning, either it may be metal poisoning or either it may be any kind of drug related poisoning, the treatment will be in this form. That is, first stabilizing the patient, next decontamination, supportive treatment, elimination, and antidote or any kind of drug therapy. So these are the antidote and drug therapy means if the poisoning is in more level. So what are the antidotes or what are the drug therapy that we should given? And if the person is died unfortunately, then the autopsy findings means how the body parts are affected by this poisoning. Now coming to the stabilization. So as this metallic copper will get embedded in the skin, it will produce an increase in the serum concentration. So we should monitor the serum concentration and also in the serum copper concentration and in the urine copper concentration, as it will be very deeply embedded. So we have to monitor these levels with significant type of copper exposure. that to dermal exposure patients. So this is the stabilization parameters in the patients that we should take in the copper poisoning. Coming to the decontamination techniques, there are actually different ways. So coming to the eye, if the eye is exposed, if the person is wearing any other type of contact lenses, those should be removed and they should be irrigated. Means the exposed area should be irrigated with some amount of 0.9% saline or water for at least 15 minutes at room temperature. And if after 15 minutes also, if there is any kind of pain or irritation or any swelling at the eye area or in the inside of the area, then examination should be done. That is, the eye examination should be done. And coming to the skin, so the contaminated clothing should be removed. That is the first method. And second method or the second step is the washing exposed area with soap and water. And even if irritation or pain is present in that area, the physician examination is needed for that area. And if the copper concentrations are increased or if they are in higher amounts, then chelation therapy or chelation therapy is done by using the agents like D-penicillamine, triene, zinc acetate and tetrathiomolybdate. And combination of the zinc acetate and the combination of the drugs drugs or the agents like zinc acetate and tetrathiomolybdate combination is very effective. So these are the methods, decontamination methods, that which are used in the skin exposure conditions. Now coming to the gut. So the decontamination methods means emesis is contraindicated, means making the patient to vomit is called as the emesis procedure. So emesis is contraindicated. And stomach wash is done with the solution potassium ferrocyanate solution. So what this potassium ferrocyanate will do means, this will convert the copper salt. Means, for example, if the copper sulfate is ingested by the patient, then this potassium ferrocyanate solution will convert this copper sulfate to insoluble cupric ferrocyanate. So then it will be less toxic and it will be removed. So by the stomach wash procedure. Now coming to the supportive treatment. So supportive treatment will be involving actually the symptomatic measures or any other kind of disorder management. Means for specific type of condition, the specific type of procedure is done by giving the drugs or by giving the medical type of treatments. Now coming here, first one is if the patient suffered shock, dopamine, and prevention of gastric erosions, antacids, ranitidine, so such type of agents are given. And for the hair color disorder means there is a shampoo, that is penicillamine drug containing shampoo. So 250 ml type of shampoo means we have to use with the dilution, like 5 ml of shampoo should be diluted with 5 ml of water. So such type of shampoo can be used. And EDTA, so either penicillamine containing shampoo or EDTA. So these both will be effective in removing this green color from the hair. And administration of egg white or milk orally, it may actually help in detoxifying the copper, that which is resulting in the formation of albuminates. And coming to the elimination procedures, extracorporeal techniques like hemodialysis are said to be useful, that too in early stages of poisoning. Means when the metal is still circulating as a free copper, not in the form of bound copper. So hemodialysis procedure is effective in early stages. Now coming to the antidote or drugs therapy. Here in the copper sulfate intoxication, means because of the acute type of copper sulfate poisoning, dimercaprol should be given and its usual doses 3 to 5 mg per kg per dose. So this is the usual dose. DPIM means intramuscular route. That too it should be given for 4 hours. Means for every 4 hours for 2 days. And after days means these should be given in the form of 4 to 6 hours again for additional 2 days. And for another 7 additional days it can be given for every 4 to 12 hours. So for acute copper toxicity, dimercaprol is given in such type of forms. And calcium sodium meditate is also given. That too its usual dose is 75 mg per kg per day. That is 24 hours. It can be given either through DPIM or slow IV infusion in 3 to 6 divided doses. And in this calcium sodium meditate, Each dose shouldn't exceed 500 mg per kg depending upon the weight. And D-penicillamine. Coming to the adult's usual dose, it is 1 to 1.5 gram. For children, 10 mg. And it can be actually increased up to 30 mg, and it should be given in the form of divided doses, that too in 2 to 3 divided doses. And this drug is actually a drug of choice for the Wilson's disease. So this D-penicillamine drug up to 100 mg per kg per day in 4 divided doses it will be given. So this will be also depending upon, and it should be mostly used depending upon the severity of the poisoning and also the adverse effects. This D-penicillamine should be actually given before meals, and maximum dose per day is 1 gram. And coming to its contraindications, it is contraindicated in pregnancy conditions because it can cause cerebral palsy and webbing of the fingers and toes and hydrocephalus conditions, and even for short periods in low doses, it may cause teratogenic effects in the pregnancy condition. And the other drugs like unithiol. So this unithiol is also used in the usual dose, like in the 5% solution. It can be given, or it should be given through IM or subcutaneous route. So IM is 5% solution. Subcutaneous route means 5 mg per kg, and it is not actually FDA approved. And other kinds of drugs like N-acetylcysteine. So this N-acetylcysteine can actually cross blood-brain barrier. So it was actually developed to prevent any kind of neurodegenerative disorders. And so these are the treatment measures, that is the antidote and drugs therapies measures that we should apply or we should give in a copper poisoning patient. Now coming to other findings, like if unfortunately a patient dies or the person dies, then the person's autopsy findings, if the autopsy is done, then we can observe like greenish or bluish type of stomach contents can be observed. And the skin will be in the form of jaundiced type of condition, like jaundiced skin and conjunctiva. And the hepatic and the renal will be necrosis, means the hepatic cells and the renal cells will get necrotized. So these are the conditions. And thank you so much for listening to my presentation, and I hope all of you have actually understood my presentation regarding the copper heavy metal poisoning. And if you have any kind of doubts regarding the copper heavy metal poisoning in the part 1 or in the part 2, you can comment me in the comment section below. And if you like my video, like, share, subscribe, and please comment to my video. And please subscribe to my channel and support me. And thank you.